Good afternoon, students. Welcome in HCP lecture. Today I will start the new chapter of hospital and clinical pharmacy. In that part 2, clinical pharmacy, chapter number 7, adverse drug of reactions. Okay. Let us first shortly look at what we saw in previous lecture. Drug interaction. First point is introduction. Then reasons of drug interaction. In that, first point is use of OTC drugs. Then patient non-compliance. Then multiple physicians, drug abuse or misuse. Then potent drugs. Okay. The next point of drug interaction is role of pharmacist in drug interaction. Okay. In that, he is ideal person who can play a vital role in preventing interactions of drug by advising the patient on the following, that is, first is do not use OTC drugs without the consultation of physician. Then strictly follow the instruction given by the physician regarding administration timing and doses. Then if receiving treatment from multiple physicians, inform them about the illness before taking the medicines. Then do not consume the drugs in excess apart from recommended dose. Then do not take different drugs at once. Then last is which type of food is forbidden for the particular drug. Then next point is mechanism of drug interaction, in that pharmacokinetic and pharmacodynamic interactions. In pharmacokinetic, first is GIT absorption, in that change in pH, then absorption or complexation of drug, then GIT status and other factors. B is alternative in distribution, then change in metabolism, in that enzyme induction and enzyme inhibition, then change in excretion, in that pH of urine, then competitive excretion. And in pharmacodynamic interaction, first is drug having opposing pharmacological action, that is antagonism, then drug having similar pharmacological action, then drug competition at receptor site, then change of electrolyte level. And then next point is drug interaction, in that analgesic drug interaction, diuretic drug interaction, cardiovascular drug interaction, then gastrointestinal drug interaction, and then vitamin interaction, and last one is anti-diabetic agent interaction. Then in that combination, then mechanism of interaction and clinical significance we have already seen in previous lecture. Okay. Then last point of the chapter is drug food interaction, in that dilution of drug, then absorption or complexation of drugs, change in gastric emptying and examples. Okay. These are all about the drug interaction. Now today's I will start the new chapter is adverse drug of reactions. First point is introduction. Medicines can be used to prevent, treat disease or illness. However, few times it can cause the trouble. Such troubles is called as adverse drug reaction. Okay. What is the adverse drug reaction? Medicines can be used to prevent the treatment, disease or illness. To treat the disease or illness. However, few times can cause trouble. Such troubles is called as adverse drug reaction. The drug has the ability to produce many effects, but the physicians mainly wants a patient to experience only one of them, and remaining effects may be considered as undesired. And then the term adverse drug reaction is more appropriate for the effects that are undesirable, undesired, unpleasant, then noxious, potentially harmful. Then there are many definitions to describe the adverse drug reaction, but World Health Organization defined it is a response to the drug. It as the response to a drug which is noxious or unwanted, occurs at dosage normally used in the human being for prophylaxis, diagnosis or therapy of disease. But who defined it is as response to a drug which is noxious or unwanted, occurs at dosage normally used in the human being for prophylaxis, diagnosis or therapy of disease. The adverse drug reaction is more frequent in patient those who take self-medication in large number of drug which dosage or treatment taken at once from physician for different ailments. These are the introductory part of adverse drug reaction and definition of adverse drug reaction. Then role of pharmacist in adverse drug reaction. That there is the limited scope to the pharmacist in the performing clinical studies or toxicity studies, but can collect the information from patient's medical history, which will be helpful to him at the time of patient advices, counseling, and therapeutic monitoring. These are the role of pharmacist in adverse drug reaction. Then next point is drug induced diseases. In that, apart from the therapeutic actions of drug, it may be act on the different systems or organs as well. Their characteristics of drug can induce the disease condition as discussed below. First is drug induced gastrointestinal disorder, then drug induced liver disorder, then drug induced renal disorder, then drug induced hematological disorder, then drug induced dermatological reactions. Okay, firstly, see the drug induced gastrointestinal disorder. In that, oral routes of administration for a drug is very common. Okay, is very common. In a single prescription, almost 80% of drug is oral form. Therefore, is the great possibility for the GIT disorder. Then this column are the adverse drug reaction and example of the drugs. First is vomiting. Then example is most of the drug given orally. Then occur a vomiting. Then dizziness. Then constipation. Constipation is the second is dyskinesia is the example of drug is antibiotics, then bitters, alkaloids and metronidazole. Then third is constipation, verapamil and morphine. Then diarrhea. Example of drug is ampicillin, neomycin, cardiotonics and atropine. Then last is ulceration is the salicylates, NSAID and sulfa. NSAID means non-steroidal anti-inflammatory drugs. Then next is drug-induced liver disorder. In that, drug are metabolized and excreted at liver site. It is commonly affected by the drug. About 10% of drug may causes jaundice and acute hepatitis. The hepatotoxic drug are categorized into two types. Drug causing direct liver damage because of some specific chemical structures and properties. They may be alter or cause interference in metabolism. Example of the isoniazid, tetracycline, then methotrexate and aspirin and cimetidine. Then drug causes the damage to liver by host hypersensitivity. Drug causes damage to liver by the host sensitivity. Example is the sulfonamide, then erythromycin and EMAO inhibitors, phenytoin. These drugs cause allergic reactions such as fever and eosinophilia. Okay. And the remaining part of this lecture we will see in next lecture. Okay, I will stop here. Thank you.